Hello, my name is Gabrielle Olivas, and I will be presenting a comprehensive SOAP. So today, my patient is an 8-year-old. His initials are CR, and he is here for a well child exam. He comes in with his foster mother, who does have concerns with his diet, his behavior, and she believes he is having problems with his hearing. So my HPI, this is an 8-year-old male who comes to clinic for his initial visit at this location. This child has been with this foster mom for 3 weeks now. This is his first physical he's getting since being with her. He is in foster care with his 3 other siblings. They're all together with his family. He is not wanting to eat as much. He gets tired easily after playing with his siblings. He was a victim of physical and mental abuse by his grandparents. He's been with his foster mom, like I said, for 3 weeks. And foster mom is also concerned that this child is becoming aggressive towards his siblings. She denies any issues with voiding or stooling. This child recently started attending school. He had not attended in 5 months, and this is the whole time he was with his grandparents. CPS is involved in this case, and foster mom did mention that since she first received him compared to this visit today, that she has noticed a change in behavior. It's gotten better, but he is starting to get aggressive. So my review of systems, his weight, she has noticed a slight increase in weight since she first received him. Per foster mom, when she first received him, this child was very, very thin. You can tell that he wasn't being fed appropriately. For skin, he does not have any rashes, adenopathy, lumps, bruising, or bleeding, and no pigmentation changes. For HE and NT, he does deny visual problems. Foster mom suspects he's having issues with his hearing. She denies him having any ear infections, anything draining from his ears. He denies a sore throat. He doesn't mouth breathe. He's not snoring, no apneas, no headaches. Mom has already set up a dental appointment for this child. She wasn't sure when the last time he had been seen. Cardiac, she denies any cyanosis or dyspnea. She denies any heart murmurs, no chest pain, palpitations, but she does notice that he's becoming easily fatigued when he's playing outside with his siblings. Respiratory, he denies any wheezing. Foster mom hasn't noticed any chronic coughing, and she denies any contact with people with TB, but again, she's only had him for 3 weeks. GI, she denies any diarrhea, constipation, vomiting, abdominal pain. Foster mom says he's a picky eater. He's only wanting to eat cereal and some vegetables and fruits, but he's refusing to eat meats at this time. For GU, he denies frequency, dysuria, hematuria, and his foster mom denies him having any issues with voiding. Musculoskeletal, he's denying any joint pain and swelling, and she hasn't noticed any new injuries on him. Medications, he's not on any medications. For allergies, he has no known drug allergies, no known environmental or food allergies. Prior medical history, as far as foster mom knows, and from what CR has told her, he has never been hospitalized and he has never had any surgeries. For family history and social history, again, this is a foster child. He's with a foster family with his 3 other siblings, but there are a total of 8 siblings who are in also foster care, but with different families, so they're all separated. Mother is in prison for unknown reasons. So due to her imprisonment, the 8 children were placed with mother's boyfriend, but mother's boyfriend could not take care of them. So then they were sent to maternal grandparents. And with maternal grandparents, this is where the abuse started or continued, because from what the kids have said is that the mom was being physically abusive as well. Grandparents were not feeding these children and the grandfather was the one who was physically and verbally abusing them with a stick. It's not known if they all had the same father, and foster mom was not aware of any history as far as cardiac disease, hypertension, strokes, cancer, or early deaths in the family. They are allowed to see. CPS allows the 8 siblings to visit each other twice a week. This child is living with his foster parents, and they live in a 4-bedroom home with 2 baths, and again the 3 siblings and foster mom's son. Foster mom's a homemaker, and the foster father is a truck driver. So for growth and development, CR is in 2nd grade, but he had not been in school for the last 5 months. Foster mom also reports that he's becoming more aggressive with his siblings. He's sleeping about 8 hours per night, and this child is denying that any of the abuse ever happened. So for objective, my vital signs for CR were temperature was 97.9, heart rate was 85, his respirations were 23, blood pressure was 109/62, his weight was 27 kilos or 41%, his height was 53 inches or 63%, and his BMI was 14.9 or 22%. His vision was 20/20 bilaterally. His hearing screen passed on the right and failed on the left. So foster mom was correct. For his physical exam, when I walked into the room, the child was sitting down, well groomed. He was listening very closely to what was being said for every child that was examined. And he looked a little concerned. His skin was pale. He didn't have any rashes or skin abnormalities, and he didn't have any signs of abuse or self-injury. His head was normal and atraumatic. His eyes were normal. He had equal movement. He did have pale conjunctiva, and he does not wear glasses. His ears, his right tympanic membrane was clear. His left tympanic membrane was perforated. He denied any pain or discharge from that ear, and he also denied having difficulty hearing from that ear. It's not known when the perforation happened. His nose, his septum was midline. He had pink mucosa, and he did not have any drainage. His throat was normal, no erythema. Mouth was moist. Palate was intact. He had normal dentition. And again, foster mom had scheduled a dental appointment for him already. For respiratory, he had normal respiratory effort. He was clear bilaterally. He did not have any coughing. For cardio, he did have a regular rate and rhythm, but I did hear a murmur, and his capillary refill was less than 2 seconds. Abdominal, he had normal bowel sounds. His abdomen was soft, non-distended, non-tender, and he is stooling every other day. For GU, he didn't have any tenderness or discharge. His testes were descended bilaterally. He is circumcised, and he is voiding normally. He did not have any issues. For musculoskeletal, he does move all extremities equally. He had normal tone, and his spine was straight. For neural, his cranial nerves were intact. He had a 5 out of 5 strength on 4 extremities. And of course, he was alert and oriented ×3. For his labs that were done, his vision, I had already mentioned, was passed. His hearing, his left ear did not pass, right ear passed. We did do the PPD to rule out tuberculosis, which will come back for results in 48 hours. And lab tests that were ordered were CBC, CMP, ferritin, iron, and B12 to rule out anemia. So for my assessment, my diagnoses were number 1, child in welfare custody, which is Z62.21. Well child assessment with abnormal findings, which is Z00.121. Cardiac murmur, R01.1. Anemia unspecified, D64.9. And unspecified perforation of tympanic membrane, left ear, H72.92. So my plan for this patient was to refer him to ENT for his perforated tympanic membrane on his left side. Referred him to cardiology for his murmur. His lab tests that were ordered, again, was a CBC, CMP, ferritin, iron, and B12. Referred him to counseling for his history of abuse. and the whole family was referred. Anticipatory guidance was obtain lab work as soon as possible. We would call foster mom as soon as we get results of the lab work done. Foster moms to take him to counseling. We discussed injury prevention. We spoke to him about seatbelt safety, swimming and water safety, prolonged sun exposure, sunscreen use, hand washing. Talked to him about continuing to brush his teeth twice a day and to visit the dentist twice a year. I also spoke to him about eating breakfast, eating vegetables, fruits, lean meats, and whole grains daily, drinking 24 ounces of low-fat milk daily, and limiting sugary drinks and foods. I spoke to him about drinking plenty of water. And because we're suspecting anemia, we asked him to increase his intake of high iron foods such as dark green leafy vegetables, beans, whole cereals, dried fruit, pork, and beef. And I also told him to be active. The recommendation is 60 minutes per day, but because he does fatigue easily, we recommended the 30 minutes or until, not to overexhaust himself. So for my debriefing, this by far was the most, it was the saddest patient case I had come across in my whole clinical rotation, like for the past 2.5 years. I never had to deal with any abuse cases or abused kids. I had seen foster kids, but never this soon after the abuse occurred. I got to talk to the foster mom alone, and she was the one telling me what had happened and how she had received them, and they came to her still with visible injuries, and how none of them even wanted to talk when she first received them, and now they're talking, they're acting as siblings. But she is concerned about this patient that I presented because he is the one that is trying to, I guess, disassociate himself with the trauma, and he's denying that anything ever happened. He's denying that he was ever even abused, and the other children, do tell him that it did happen. I did agree with the diagnosis, the plan, and treatment, and I don't feel like there was anything I could have done or would have done differently in this situation. I do hope that I don't have to come around many cases like this. Thank you.